morning, students. How are you doing? I hope you are doing interesting. Welcome to lesson 3 of week 3. Again, the lesson continues. In previous lesson, we discussed about bacterial disease, tuberculosis and cholera, including their causative agent. The causative agent of tuberculosis is Mycobacterium tuberculosis, and the causative agent of cholera is Vibrio cholerae. And also we discussed about the transmission and the control of tuberculosis and cholera. Tuberculosis is transmitted through coughing, sneezing, but cholera is transmitted by eating or drinking food or water contaminated by the fecal waste of the infected person, and also it is transmitted by poor sanitation of an area or a lack of proper sewage disposal. But there are a control or preventative mechanism. We can control tuberculosis by pasteurizing milk, by avoiding droplet infection, and by covering the mouth or nose when we are coughing, and also a migrations of overcrowded people living to lessly crowded. Lastly, cholera is controlled by taking antibiotics, by uncontaminated water or food intake, avoid eating uncooked foods, and using proper cleaned sewage disposal. Those are lessons we have discussed in yesterday class. Today we are going to discuss about the remaining bacterial disease, the third typhoid fever, and finally diarrhea. Only we are going to discuss those two bacterial diseases in this lesson. The objectives: by the end of this section, the students will be able to list bacterial disease, identify the causative agent of bacterial disease, explain the effects of typhoid fever and diarrhea, name the transmission, symptom, and control methods of typhoid fever and diarrhea. Let's discuss one by one. Typhoid fever. The bacterium that causes typhoid is a unique human strain of Salmonella called Salmonella typhi, which affects only humans. Or the rod-shaped bacterium, which is called typhoid bacillus, is the causative agent of typhoid fever. These bacterial infections of the intestinal tract that occasionally also affect the blood stream. The bacteria are passed in the feces and to some extent the urine of the infected people. Mainly this bacterial disease cause of a watery feces. This bacterial disease is spread through eating food or drinking water contaminated by feces from an infected individual, which will mean contact with a polluted water, food, milk, or green vegetables, and it passes through infected people's urine and feces. Those are the transmission ways. Symptoms. Generally, typhoid fever appears 1 to 3 weeks after exposure to the bacterium. Salmonella typhi or typhoid bacillus, but it can be carried for years. The symptoms may be mild or very severe. They may include a very high fever from 30 degrees Celsius up to 40 degrees Celsius, painful abdomen, sore throat, headache, constipation, or diarrhea. As the disease continues, rose-colored spots may appear on the lower chest and abdomen. Spleen and liver may be enlarged, which means the enlargement of spleen and the liver. If it is left untreated, the victim become delirious or difficulty in speaking, weak and exhausted, finally may die. This is the main effect of typhoid fever. How we can control and prevent? We can control and prevent typhoid fever by using antibiotics. The patient should be managed. They need to be supplied with plenty of fluids to replace what they have lost, and small high calorie foods to help them replace the minerals and energy they have lost. To control the spread of typhoid, all the factors which can affect the spread of cholera also affect the spread of typhoid, which includes careful hand wash after visiting toilet, clean drinking water, good sewage disposal, good food hygiene, and the care in eating raw and lightly cooked food, which means in general we can control and prevent typhoid fever by purifications of water supplies, by having safe disposal of sewage, by pasteurizing milk, and effective use of antibiotic treatment. The last topic of our lesson is diarrhea. Diarrhea is the fourth type of bacterial disease in our lesson we are going to discuss. This diarrhea is a symptom rather than a disease. It is a symptom and rather than a disease is a watery loose phase known as diarrhea. Infects mainly the intestine in serious ways. The causative organisms are range: bacteria, which are specifically Salmonella and Escherichia coli, virus, rotavirus, protozoans, Giardia and amoeba. Giardia and amoeba, those are protozoans. So the causative organisms that leads to diarrhea are variety: bacterial, viral, and protozoan. The lining of their stomach, small intestine and the large intestine become inflamed and painful. As a result, their body rejects and vomits out of the food, and also the water cannot be reabsorbed by the inflamed of their large intestine, resulting a watery phase called gastroenteritis or acute watery diarrhea. Diarrhea is transmitted by eating contaminated food and drinking a contaminated water with the presence of poor sanitation. Symptoms: violent abdominal cramps and pain, feeling of nauseous, and vomiting, watery feces without blood, slight fever, and general muscle ache, and also headache. This is the last portions of the lesson. We can control and prevent diarrhea. Diarrhea is controlled by having common sense, good toilet, kitchen and food hygiene, which means kitchen cabinets and the food hygienes are highly applicable by using disinfectants, lots of hand washing, and also we can prevent washing hands after the use of toilet and before preparing or eating food, drinking cleaned and safe water or packed water, washing salad, food and fruit, avoid eating meat and eggs which are undercooked or raw. Dear audience, I hope you are blissful with the lesson. Let's remind up today's lesson. In general, today we have been discussed about the remaining bacterial disease, typhoid fever and diarrhea, including their causative agents. The causative agent of typhoid fever is typhoid bacillus or Salmonella typhi, and also diarrhea, contaminants of food and water intake are the main cause. Their effects are serious to our body. Mainly they can affect intestinal tract. This is all about our today's lesson. As you remember, at the end of each lesson there are evaluation questions that can identify whether you follow me in serious way or not. Let's do those questions one by one. Again, also I wanted to give you 3 minutes to do that. Question number 1 says, what is the causative agent of typhoid fever? Question number 2, name the transmission and the control of typhoid fever. Question number 3, AWD stands for blank. Question number 4, how dehydration occurs. Question number 5, what resembles typhoid fever and diarrhea? Go on. dear follower, I hope you are satisfying with the question of classwork. Let's answer together. Question number 1. What is the causative agent of typhoid fever? You are right if you can answer like typhoid fever is caused by rod-shaped bacterium, so-called typhoid bacillus or Salmonella typhi. Question number 2. Name the transmission and control way of typhoid fever. Typhoid fever is transmitted by contact with polluted water, food, and the green vegetables, and also it is passed through infected people, urine and feces. We can control typhoid fever by purifying water, by having safe disposal of sewage, and using antibiotic treatment. If you can answer like this, you are wonderful. Question number 3. AWD stands for acute watery diarrhea. Question number 4. How dehydration occurs? If the lining of the stomach, small intestine or large intestine become inflamed and painful, resulting the body rejects and vomits out the food without reabsorbing water because of the inflamed large intestine. Finally, it results a watery face, so-called diarrhea. Question number 5, the last question. What resembles typhoid fever and diarrhea? Which means, what are the similarity between the two? Mainly, their way of transmission is similar, transmitted by contaminated water and food intake, and the effects of our body, mainly they both affect intestinal tract, and there are a range of similarities between the two. This is all about today's lesson. Until we meet next time, stay safe.